I remember my experience very clearly when we had, one of our first patients there, all prepared, and we had our physicists and the engineers and the neurologists there kind of looking at, very expectantly what was the first demonstration of blood-brain barrier opening in the world. And I think that culmination of the translational aspect of being able to move something you found in the laboratory to the bedside was very much what attracted me to this field.
Welcome to Curing with Sound, a podcast presented by the Focused Ultrasound Foundation. I'm your host, Dave Hendrick. Dr. Ying Meng is a neurosurgeon and scientist at Sunnybrook Health Sciences Centre and Sunnybrook Research Institute and a faculty member at the University of Toronto. Her research centers on developing therapeutic focused ultrasound as innovative, non-invasive treatments for brain tumors and neurodegenerative conditions. Dr. Meng has authored more than 70 peer-reviewed publications, many of them breaking new ground in areas related to focused ultrasound treatment for brain tumors and Alzheimer's disease, in addition to other topics. Among her many accolades, Dr. Meng received the Early Career Clinician Investigator Award at the 2025 International Symposium for Therapeutic Ultrasound. She recently visited the Focused Ultrasound Foundation in Charlottesville, Virginia, to tell us more about her work and the developments in the field. Dr. Meng, welcome to the program.
Oh, thank you, Dave, for having me here today.
Dr. Meng, you're a leading researcher and neurosurgeon in this exciting world of focused ultrasound. Can you tell our listeners about your background, just how you chose this path and how you got to this professional point?
So I'm a neurosurgeon scientist at Sunnybrook Hospital in Toronto. I did my training there as well. My journey began when I worked with Dr. Listman during my residency training. I met Dr. Listman when I was a second-year resident, and he was a chief resident at Toronto. And we would, while on service, have these conversations about his research, and it was really fascinating to me what he was working on at the time. And when I was ready to start my PhD project, as we're very much encouraged to do in Toronto, he had just started his position at Sunnybrook, and I very gladly joined his team. We were working on one of the first BB opening procedures in patients with Alzheimer's. I remember my experience very clearly when we had, one of our first patients there, all prepared, and we had our physicists and the engineers and the neurologists there kind of looking at, very expectantly what was the first demonstration of blood-brain barrier opening in the world. And the preclinical researchers who we were basing our research on were there as well. And I think that culmination of the translational aspect of being able to move something you found in the laboratory to the bedside was very much what attracted me to this field. And in fact, my experience at Sunnybrook to being able to translate preclinical findings to clinical trials was what really attracted me to this field.
I'm wondering if you could put into words being in that room and learning that BBB opening works.
Yeah, I think there's a sense of excitement that the device is able to deliver on what we've seen in animals. And I think, the scientists would sort of know that it's going to happen, but because they've seen it over and over and over again in preclinical studies, I don't think there's another area where there was so much preclinical studies done already to support the first clinical trial. But even then, there's still anticipation. We didn't know whether it's achievable. And at that time, we didn't have acoustic feedback. So it's sort of doing a hand injection of DEFINITY and sonicating and then doing a T1 with GAD and trying to see, is it working? And luckily, very luckily, it did work. But I just remember those early treatments where we're still trying to figure out what we're doing, obviously in a very safe way for patients. But it was a very rewarding experience for me. And that's what, kept me going all these years.
Can you take us back to the moment when focused ultrasound comes onto your radar?
I think the first time I saw one of the BE opening procedures was with an Alzheimer's disease patient. And I distinctly remember coming for the treatment and having all the engineers and all the physicists and neurosurgeons and neurologists there for the procedure and with the patient working together to kind of realize the first in-human testing of this technology and the excitement that we all had and shared when we showed that it was actually feasible to temporarily disrupt the blood-brain barrier in a patient. I think realizing that from the preclinical studies that have been done at Sunnybrook and realizing that in a clinical population or clinical patients was very, I think, electrifying for people, that their work has kind of fruitioned into a clinical trial. I think that experience collaborating with all the people there at Sunnybrook was really what ignited my passion to be in this field, particularly in my training as my undergraduate background in engineering was really kind of helped me realize that this is a place where I can bridge my relationship with engineers and physicists to what I'm doing in the clinic.
So we know there's a lot of remarkable focused ultrasound work being done at Sunnybrook, which is a focused ultrasound center of excellence. Tell us about the research and clinical ecosystem at Sunnybrook.
It's a really extremely collaborative environment. So we have a very strong technical team with Dr. Cliver Hin and Dr. Megan Riley there. And we work with them basically on a daily basis. My office is right down the hall from their labs, essentially. So I often see physicists, engineers kind of walking down the hallway, and I probably have more insightful or enlightening conversation with them in the hallway than actual meetings. And we work together on both animal experience and clinical trials, so I know them really well. It's really a strong collaborative team that we have, and without them, our clinical trials wouldn't be possible. We wouldn't make the advances we have done in the last 10 years without their collaboration. We also collaborate very closely with the neuro-oncologists at Odette Cancer Center. So, and these are my colleagues I work on a daily basis from the clinical perspective as well. So it really is a very close-knit group of people who have a shared vision for focused ultrasound. And without that passion and shared vision, we wouldn't be where we are today.
Are there lessons from Sunnybrook that you might share with other sites interested in growing their capabilities with focused ultrasound?
I think you really need a very strong technical team who have the patient safety in mind, who know kind of all the intricate details of their device and how ultrasound behaves in real life. So, when we have a finding where we're not quite sure what make of, when we see a finding on an MRI, we can, have a very good discussion with the technical team about what's going on, what kind of things should we be trying next to kind of make sense of something or optimize something better. So there's always a very open line communication with them. And I think that's something that's, absolutely necessary when you're starting out a focused ultrasound program in any new institution.
I hear you say collaboration, communication, and technical expertise.
Absolutely. Yeah.
You're helping to lead a pediatric clinical trial at Sunnybrook that seeks to evaluate the safety and feasibility of blood-brain barrier disruption combined with doxorubicin in children with glioma. Could you tell us more about the state of that study and what the implications might be?
So that's a collaboration with Children's National, where we are trying to deliver doxorubicin to basically an incurable disease in patients where the treatments are not very good and the outcomes are poor. It's a type of tumor that typically doesn't enhance. So the rationale is that we can disrupt the blood-brain barrier and try to get more drug through. Here, we were using doxorubicin. So the trial is a phase 1 trial. We're looking at safety and feasibility. It's a very eloquent area in the brain, the pons. So we're very much closely monitoring their vitals while patients are getting the treatments, and also afterwards, whether they're having any untoward side effects. So we've recruited and treated 3 patients at Sunnybrook, and in collaboration with Sick Kids, obviously Dr. Rucka, Dr. Lipsman, who are the PIs on the study, and patients have tolerated the procedure well. It's a challenging study to recruit the patients and to have them undergo the procedure. They're generally young children, and patients generally need to be under general anesthetic to have the procedure done. But we're very grateful for the patient and their family for their participation, and they fortunately have all done very well, and we've gathered the data that we needed to move on to the next phase of the study.
That's wonderful. You were also part of the clinical trial using focused ultrasound-mediated BBB opening to deliver trastuzumab in patients with breast cancer metastasis. Can you tell us about that trial, and could you describe your findings?
So that's one of the studies that I'm very much excited about, and that was kind of a big project I had during my PhD research. The importance of that trial was the ability to radiolabel trastuzumab, so we can see where is it going in the brain. Prior to that study, it's very hard to know how much drug has gotten through, especially with these larger molecules. So, typically studies are done with MRIs where we do a T1 GAD contrast enhanced T1 weighted MRI to basically see if the blood-brain barrier permeability is changed. And gadolinium is a much smaller molecule than many drugs that we're trying to deliver. So being able to radiolabel trastuzumab, we're able to see whether it gets through to the tissue that we're targeting at a greater concentration than without focused ultrasound. And that was the importance of the study, in being able to show that it truly is getting through and doing what we expect it to do in clinical participants.
You were also part of the team at Sunnybrook that first demonstrated a novel liquid biopsy technique. Could you remind our listeners exactly what that means, as well as the significance of your findings?
So that was a study that we did as part of our trial looking at safety and feasibility of opening the blood-brain barrier in patients with glioblastoma when they're undergoing adjuvant TMZ treatments or temozolomide treatments. So the intention of the study wasn't in the beginning to look at liquid biopsy, but it was sort of serendipitous that we did see changes in the blood biomarkers as a result of BBB opening. And that was sort of one of the very reproducible effect, and we saw in every single treatment in patients. This was inspired by Dr. Han Chen's work in preclinical studies where she looked at biomarkers that were leaking out from the brain in rodent glioma models. And we wanted to see if this can be detected in clinical samples. And we, in fact, found that there was an increase in cfDNA after BB opening. And this was shown in other studies as well, and in a multi-center trial that was recently published. In fact, that if you looked at the degree of amplification or enhancement, it may be an important predictor to early patients who are responders to treatment versus the early recurrence patients.
So again, lessons learned that we can apply to the way you practice today.
Absolutely. And this was followed up by another trial that specifically looked at liquid biopsy as the main goal of the study, to see if after BB opening, the blood samples contained tumor markers that could be corresponded to their surgical samples. So the result of that study is yet to be published and made available, but very much excited to know the result of that.
That sounds exciting. What are the barriers to growth for focused ultrasound in Canada, where you practice?
I think, as with any novel technology in Canada, it's funding. If we look at thalamotomies, even though that's clinically approved and available, I think it's the ability to make it available to anyone who wants it. It's available, but there's a long wait list for patients to get this kind of treatment. So in thinking about how BBB is going to translate into a public healthcare system, if it were to be approved and part of standard of care, it will have to be somehow made cost effective enough that everyone can get it in a publicly funded healthcare system. So that may mean that there has to be changes to technologies where it's, less expensive, less resource intensive. So these are all things that we, as engineers who are working in this field, need to think about in order to make it kind of applicable and accessible to everybody.
Where do you see focused ultrasound in 10 years?
So in that same line of thinking, I see ultrasound as being something you could just get in the clinic, not necessarily have to, the device that we use is coupled to an MRI, and patients get a hair shave and they have a frame placed. So, even now the technology is moving away from that, right? So I see BBO opening happening in the clinic, like at a drug infusion center where people get chemotherapies and cancer therapies, and that they would simultaneously get blood-brain barrier opening procedure done at the bedside. I think that in that way, it's more tolerable for patients, and it will be more easily adopted by clinicians as well.
That would be amazing. At the Focused Ultrasound Foundation, we talk a lot about the promise and potential of focused ultrasound. What does focused ultrasound mean to you?
I think it's a way of non-invasively changing the physiology of the brain that we haven't been able to do so before. Focused ultrasound is attractive because it doesn't cause permanent damage. At the same time, it is having so many different interesting biological effects, whether that's neuromodulation or BB opening, that we can think about different ways of applying to many different disease indications. And it's also a very portable and cheap technology that it can be, in a way, made available, hopefully one day, to all patients.
So we've been speaking almost exclusively about your professional expertise. Could you share a bit about yourself outside of work?
I have a busy home life as well. I have 2 young children. I have a daughter, 8 years old, and a son, 6 years old. They keep me very busy at home when I'm not working. We enjoy lots of sports activities. We love going skating. We love going hiking. And so that's how I occupy the rest of my time at home.
Excellent. Thank you so much for joining us today. Any closing thoughts?
I would just want to say that the Focused Ultrasound Foundation has been so supportive of the work at Sunnybrook, and so easy to work with. Everybody I've met at the foundation has been very passionate about their work, and seeing this technology grow. I would, just want to thank everyone here at the foundation for supporting us and all the work that's been done by other centers around the world.
This episode of Curing with Sound has been presented by the Focused Ultrasound Foundation. If you'd like to learn more about Focused Ultrasound or the Foundation, visit our website at fussfoundation.org. You can also sign up for our newsletter, News Digest, and follow us on social media. Be sure to subscribe to the Curing with Sound podcast so you don't miss the latest information on Focused Ultrasound. We would also be grateful if you would rate and review the show.